Good afternoon, I'm Patricia, research physician from Moro. I would like to take this opportunity to talk about melioidosis in Indonesia and the challenges we face now and in the future. So let's start with some general information on melioidosis. Melioidosis is an infectious disease caused by Burkholderia pseudomyelitis. It's difficult to diagnose because it has no specific clinical presentation and can be mistaken for other infectious disease. The current diagnostic standard of melioidosis is culture. However, bisidomyelitis can be misidentified as a culture contaminant or as another species. Bisidomyelitis is also intrinsically resistant to many antibiotics, which make the disease difficult to treat and has high case fatality rate. A recent modeling study estimated that there could be as many as 165,000 human melioidosis cases with 89,000 deaths worldwide, while in Indonesia, it estimated as many as 20,000 human melioidosis cases with 10,000 deaths per year. Is the estimate number of melioidosis relevant with the available data in Indonesia? Then we collected melioidosis cases in Indonesia. The total number of melioidosis cases were 146 cases, including 101 cases from published or reported melioidosis cases and 45 from unpublished culture-confirmed melioidosis cases. Of 146 cases, 42 cases have clinical manifestation data to be evaluated. So this is the location of all melioidosis cases in Indonesia. For more detail, please refer to the journal. This table illustrates the demographic data, clinical presentation, risk factor, and outcomes of 42 melioidosis cases. Of 42 melioidosis cases, 27 cases were adults and 15 cases were pediatrics. Bacteremia, pneumonia, skin and soft tissue were the top 3 most common organ involvements, while diabetes, chronic kidney disease, and unknown disease were identified as the top 3 risk factors from these patients. The overall mortality was 42%. This table illustrates the specimen diagnostic method and the reported but unverified antibiotic susceptibility test. As we know that FITEC2 is the most common method used for bacterial identification in Indonesia. However, using FITEC2 for bisidomyelitis identifications may have some problems. Some antibiotic susceptibility tests in these tables were not typical for bisidomyelitis because it should be about 100% sensitive to amoxicillin clavulanic acid, ceftazidime, doxycycline, meropenem, and 3-metroprim sulfamethoxazole. For this reason, we note that some isolates might not actually be bisidomyelitis, or the antibiotic susceptibility test may be inaccurate because the antibiotic susceptibility tests for bisidomyelitis were not routinely performed in the laboratory in Indonesia. Nonetheless, 9 available isolates were confirmed as bisidomyelitis using 16 sRNA gene sequencing and PCR assays. So for the current recommendation and availability of measures against melioidosis, the first one is to provide national guidelines for diagnosis, treatment, and prevention of melioidosis in Indonesia. The second one is provide education about melioidosis to all clinicians and improve communication between clinician and the laboratory team. In the future, it's important to melioidosis to be included in the curriculum of all medical schools in Indonesia. The next recommendation is to implement a simple and easy to perform laboratory algorithm to identify Basidiomalacia from clinical sample. So this is the example of simple algorithm. The Basidiomalacia were defined as gram-negative bacil, positive for oxidase test, resistant to colistin and gentamicin, and sensitive to amoxicillin, clavulanic acid, ceftazidime, doxycycline, and trimethoprim sulfomethoxazole. To evaluate medical practitioners' knowledge and awareness of melioidosis in Indonesia, I developed an online questionnaire and distributed by WhatsApp application. So, of 568 medical practitioners that completed the online results, 57% of participants never heard of melioidosis. 44% participants accurately answered the cause of melioidosis. 27 participants accurately answered the recommended diagnostic test, and 18% participants accurately answered the recommended treatment for melioidosis. So based on these findings, the current challenges are increased awareness of melioidosis among all healthcare workers. Because melioidosis is not a notifiable disease in Indonesia, we should establish an online system for melioidosis reporting to encourage healthcare workers and policymakers to give attention to melioidosis as it deserves. The second one is to improve communication among all healthcare workers, including doctors, nurses, laboratory team, and epidemiologists about melioidosis and Basidiomalacia. The third challenge is to increase the use of bacterial culture in Indonesia. For this point, we face three problems, including difficulty to provide equitable microbiology services in Indonesia, limitation of trained laboratory staff, and limitation in the financial and regulatory support from government, particularly in the National Health Insurance System or BPJS era. After the diagnosis of melioidosis is improved and the burden of melioidosis is as high as expected, the future challenge is strengthening biosafety and biosecurity, and preventing melioidosis by multifaceted intervention, such as reducing exposure to soil by using protective gear, particularly for the people with the risk factors such as diabetes mellitus, cancer, kidney disease, or lung disease. Because Indonesia is an agricultural country, and the majority of people are rice farmers, and we also have more than 10 million population of diabetes patients. So it needs to develop a prevention program to reduce people exposure to Basidiomalacia in the environment. And the last challenge is to educate people to seek medical attention if sepsis, not only melioidosis, is suspected. In conclusion, melioidosis is endemic throughout Indonesia and associated with high mortality. Our top priorities are increased awareness of melioidosis, increase the use of bacterial culture, and ensure accurate identification of Basidiomalacia and diagnosis and treatment for melioidosis. Thank you for your attention.